Thank you, Chairpersons. Thank you, HitCon, for this opportunity to address this August gathering. The title is, I have tried to rhyme it with HitCon. I am trying to hit hard to the audience who are not using EMR. So my first question to the audience here is, how many of you are using EMR in your private practice? I understand all of you are doctors and practicing. जरा हाथ ऊंचो करो बराबर तो मैंने गणता फावे. So about 7-8 people are using EMR and there are about 30-40 people sitting here. So the scenario is very dismal as far as use of EMR is concerned, and that's why we have selected this topic, although this seems very primitive actually. For a conference like HitCon, which has been going on for last 9 years, this is the 9th edition I believe, so this is something very primitive, but then we as doctors realize, we in the computer group, I represent Computer and Medical Informatics chapter of IAP, that is IAP is Indian Academy of Pediatrics, where for last 2 decades we have been trying to promote use of computers, and we as pediatricians can very proudly say that many of us are using computers in our practice, but somehow the other specialties are not picking up. So let us move on to common scenarios. An old patient has come without previous prescriptions or files and you are at a loss to remember his history. I mean, this often happens that patient just drops in and he doesn't carry any paper, then you don't know what you had prescribed earlier, what you had talked to him, what you had made a diagnosis about. The chemist dispenses wrong medicine thanks to your illegible handwriting, and most of us have faced this situation. Sometimes I can't even read my own handwriting. I have to ask my wife that please read this. So this is a very common scenario. The patient shows all reports on his mobile and you are uncomfortable, that how to read that on the mobile and how to then duplicate in your case paper. It's very difficult. Medico-legal case comes up and your papers are misplaced. Again, a big problem. You feel irritated at number of certificates and other documents demanded by patients. These days, patients demand a lot of papers with you. There are certain common conversations that we come across in routine conferences, like I have purchased both hardware and software, but hardly have the time to use it. And this is very common. People have, in enthusiasm, purchased hardware, software, but they are not still using it. Then the question is, why should I when I do not need it? I mean, the people feel very comfortable with the present style of their working. I do not know which software to use. There are some issues regarding choice of the software. And there can be problem with accounting. People think about income tax when the things are put on paper, and some have the fear of staff resisting the change. So the objective is to reiterate the need for meticulous medical records. There is no denial to the fact that we need to keep our own medical records very meticulously, to define EMR and to enlist the advantages of EMR, to briefly guide about how to go about it. I will show some glimpses of EMR that I use and the final verdict. So do we need to have a meticulous medical records? This question looks very irrelevant or stupid, I would say, but still in the present scenario what we see in our medical practice is there is utter lack of good medical record keeping. It's a fundamental to quality care of patients for both OPD and IPD. The basic records like history, physical examination, investigation reports, diagnosis, management plans and treatment. I often wonder, so many of our colleagues, they practice without any kind of records, and I really wonder whether I am a moron who cannot remember all the history, or they are super experts who can remember the history and everything without any paperwork, but that is happening. Quality patients care is impossible without such records, and increasing need due to insurance and medico-legal perspective also, we need to keep that in mind. What is the history of medical records? When I started making this presentation, I just went back to my earlier days in 1980s when I did my residency. So as a resident in pediatric department early 1980s, I used to have a special posting in the medical records department to physically study the records and make tables, analyze and make an annual report. That was one of our duties to do in the second year residency. When I started practice, visited a very senior urologist in our town, Baroda. And it was awesome. One of the pictures our earlier speaker had shown of the physical records. He had a very meticulous record keeping system. He had one big room dedicated to it, and he had all the physical papers with him. But how many of us could replicate? I do not know if anybody can do that kind of record keeping with papers. In private practice, OPD, very few would record clinical data and rarely would keep a copy of it. So EMR and EHR, in the previous talk by, I think, Dr. Desai, he talked about digitalization of the hospital. That was a very broad, very good perspective taken on the how we digitalize our practice. EMR is part of it, and there he had mentioned about EHR also. So electronic medical records and electronic health records are often used interchangeably, but they carry more or less same meaning. I would say EHR is a little broader perspective, but for our purpose, it's a system of digital recording of all medical records with easy retrievability and amenable to analysis to help improve medical care. That is the perspective with which I am talking about EMR. The current scenario, I have not been able to find statistics about India as to how many private practitioners are using EMR, but the general impression is that large multi-speciality hospitals have adopted EMR by more or less of compulsion because of the insurance and other issues. They have to have EMR in place. So smaller nursing home, we do find some of them use EMR, but individual clinics very slow conversion from physical to EMR. As I said, pediatricians are by and large moving towards more EMR, but other specialties are not. But the market is flooded with EMR and practice management software. There is a huge number of softwares now available. Legal requirements are knocking at our doors. I understand the government itself is trying to sort of bring in a compulsion or mandatory requirement to keep our EMR. So why do I say no EMR to no medical practice and no medical practice? Because in this era, physical record keeping is a sign of stagnation, I would believe. You are stagnating if you are not digitalizing your practice. To digitalize or not to is a question which is very, very irrelevant. Now it's a compulsion, it's mandatory. By not only constitution it will happen, but by the requirements of the patient, the kind of practice we do and the kind of expectation that patients require, I think it will become compulsory. There are several issues in paperwork which are non-negotiable. Illegible, horrible looking prescriptions, they are miles away from an ideal prescription. Leave aside only the reading of the medicines, but what all meaningful prescription can mean, we'll see later on. Lack of recording of important sections of clinical history, quality of follow-up is left to the, as I said, falling memory of the stressed out doctor. There's a huge wastage of time in manual recording for those who want to really record. There's a huge wastage of time. And due to limitations of records, most doctors compromise on this vital aspect of practice. The follow-up is not properly done because of lack of records. So friend, digitalization is the way to go, and which sphere of life is not affected by information technology? Then why should we be left upon? And there are enormous advantages. Let us try to list the advantages of EMR. Everything a few clicks away. Whatever you want to record is just few clicks away from them. It's a lot of saving of time. Easy recording of clinical data, physical, your clinical history, physical examination, etc. And you have a checklist, so it adds a lot to the quality of practice that you do, because you are less likely to miss anything if you are going by the checklist which is seen on the screen. There are ready-made templates. You can make your own templates for history and physical examination, so recording becomes very easy. You can create your own list of diagnosis, or you can use your ICD list also. There are multiple choices for stereotypical precision for a diagnosis. It's easy to order investigation. You don't have to write CBC, MP, or etc. You just click few things and the order is ready. There is an easy attachment of PDF or images of reports. As I mentioned, an example of a patient bringing a PDF report, which is very common nowadays. You ask them to transfer it to our mobile, and we can easily upload it on the software, so you don't have to rewrite everything, and the report is seen in the case history of the patient. I emphasize much on the precision because I believe that precision is the signature of our practice. Your precision reflects what kind of practice you are doing. So there is a legible precision with patient demographic and anthropometry details. Like everything is there, his name, etc., address, etc., and the height, weight, etc. Certain vitals also can be recorded every time by the staff. There is option of precision in local languages. You can use Hindi, English, Gujarati, Marathi, whatever. Option of choosing from various trade names. Facility to create standard precisions for common illnesses. So you place URTI, and with that you can have 5 such typical precision. You can choose any of that. There is automatic calculation of doses. You can share precision online with the patient. A lot of instructions can be incorporated in the precision, like about how to use the medication, the reminder for visit or vaccine next visit. Follow-up instructions, special instructions regarding the disease, like say if you have made a diagnosis of viral hepatitis and you want to put 2-3 sentences in Gujarati or English regarding what kind of care can be given. So special instructions, all this can be done in local language. Analysis data is very important because if you really want to improve on your practice, if you want to do self-audit, if you want to practice rationally, you need to have a look at your data periodically, and that is possible only with analysis. So number of patients in a given period, like quality of practice can also be improved by looking at your data. You can make your plans for future if you have good data with you and you can have analysis of that data. Analysis of new and follow-up cases, dropout cases, analysis by diagnosis, self-audit about uses of drugs which can help you rationalize your therapy. You can do research in private practice with all this data. Analysis of referred patients. There are certain very useful features like allergy reminder, pop-up secret reminders. In our practice, we do have certain things which will help us in preventing certain mishaps in our practice. So very secret reminders can also pop up regarding some of the patients. Then previous visits, previous investigation, ready to, you can generate certificates. People ask for a lot of certificates. One day illness and the parents ask, okay, we want a certificate to be submitted in the school, even though the child may be studying in only a nursery. But this is the kind of demand that patient make, and you don't have to spend time on writing certificates, they are ready.
Remaining, please.
Immunization schedule, I will take 5 minutes. Immunization schedule can be easily made, growth charts you can easily see. And along with this, I am talking about EMR, but most of the things which are available now, they are bundled in one packet. And you see a lot of practice management tools along with the this clinical software. So appointment, then accounting, a lot of things can be done in accounting automatically. There are a lot of registers we can have. And there are certain other things also, like say intra-network messaging, which is a great communications tool. Even if you have a small setup, this intra-workstations communication is very, very helpful. There is a wonderful front desk operations, prevention of duplication of work, and better utilization of resources. How to go about it? There are a few steps which we need to take. Overcome the mental block first. Get yourself and the staff initiated. Get good, reliable hardware vendor. Set up the system. Go for networking. Purchase a software. Start small and gradually build up your practice. Enjoy the fruits of automation and IT. Software is a C. A lot of softwares are available with a lot of features, but you don't have to master each and every feature. You use what is needed for you. So go slowly and gradually build up your confidence. Get familiar with most important and useful features, grow at your own pace, and enjoy the fruits of automation. There are certain mental blocks when it comes to using, like say 70-80% of you are not using EMR. So there are certain mental blocks in your mind which are hindering your progress towards adapting the technology. So question asked is it necessary? Why rock a stable board? I have been practicing for many years without the help of EMR. Why should I have it? Can I learn? Can my staff learn? Will it cost a fortune? Will it slow down my work? Will I lose eye contact with the patient? Will IT guys frown on me? So these are some of the myths actually. These are myths, these are misbeliefs, and we need to come out of them. Rocking a stable board, you must aim higher. When you are practicing for many years or few years, we all want to grow from within. And this is value addition to your practice. So don't say that you have a stable board. We all need to grow further. Learning, do you need to know how your car works? You just simply drive the car. You don't have to learn how the engine works. It's the same way here. Cost is not a big deal nowadays because earlier the things were very costly. Now the things are very cheap and the softwares are available for something like 5,000 rupees per year, or some of the softwares are available for few thousand rupees, 15 to 20,000 for lifetime. The speed actually, in fact, it doesn't slow you down. You have more space, more time to talk with the patients. Eye contact you never lose because computer is not examining the patient. Computer is not talking to the patient. It's you who are talking. Only thing is you are recording the things electronically, and which is done very fast. I also emphasize to have a network. Don't take only one PC and where only you can work. No, always have even if you have a small setup, have a network because there are a lot of advantages of network. Because of lack of time, I am not going to details. Regarding the ideal software, there are a lot of things which can be talked about software, but the most important thing, it should be user friendly. You should be comfortable with using that. There are so many things which are important in a software, but lack of time is preventing me from going into detail. One point which I want to emphasize here is the server-based versus web-based software. Outside also you will see some stalls which are now all web-based software. There are some which are server-based. Server-based means it's in your setup, the server is in your setup, and you have all the control over the data. Whereas cloud-based software is handled, the data is handled by some third-party agency. Of course, they will always tell you that there is a lot of encryption and your data is very safe, but the fact remains that data is not with you. So, but there are a lot of advantages of web-based software. You can, even if I am sitting here and if I want to teleconsult a patient, even on my mobile or tablet, I can do teleconsultation with all the data with me. So that's the advantage of web-based, and there are many more features which are not available with server-based or dash-based software, which are available with web-based software. So these are some of the glimpses. Very quickly I will go. This is the main window. These are appointments. These are days list. At the end of the day, if you want to see how many patients you have seen, what are the various charges you have collected. These are the clinical data. There are various columns in the software which I use, like chief complaint, then fever, and then various things about fever, like high-grade fever, intermittent fever, with, without chills, etc., etc. These are only few clicks away by which we are building up the whole history and physical examination. The diagnosis also on the left side, where I have put the arrow, you can see, you just type TON and you will get tonsillitis and related things. Then there is a choice of precision. If I say put a diagnosis of exudative tonsillitis, I have an option of prescribing various brands. So these brands are available as a template, and you just click. There are certain important reminder pop-ups which can come up. Suppose some patient had misbehaved with you or your staff in some time, and that patient comes up again. If you put a secret reminder, it will pop up. Okay, you become a little alert about this patient. So this is the guy who had misbehaved a couple of years back. So you be careful. So important, these things come up. These are regarding the language, various language in which you can put the same precision. Here I put it in Hindi, English, and Gujarati. Attaching a PDF, as I said, investigation report can be easily attached. These are intra-network messages where if somebody, suppose you have come to see me, my receptionist will not phone me that Dr. Yatin has come. No, he'll just type it, Dr. Yatin has come. So it doesn't interrupt my working, and I can see the message. 3C register, which is a requirement, can be easily at the click of button, you can do it. These are some of the things which will help you in plan your further practice, like which season you are seeing more patients, which are the days on which you are more busy. This can be easily done. We pediatricians use growth chart, so easily it can be done. Inventory of vaccines can be easily managed. I have a small clinic. I am not running a big hospital, but all these features I am using. Then SMS, this can be done through your software, and you can look at the SMS log also. Teleconsultation also, these things help, because you see this my image here, but at the same time I am able to look at my software, and as the patient talks to me on teleconsultation, I can put down all the complaints, etc., finding, etc., as I do it physically when the patient is sitting in front of you. It's just like it's a real feel that the patient is sitting in front of you and you are recording your all the data. So friends, verdict is no AMR, no medical practice. Thank you for your attention.
Thank you, sir. Now I request both the chairpersons to present a memento to Dr. Satish Pandya. Thank you. Now the next lecture is from Dr. Pagap Chatterjee, but unfortunately he could not come in person over here, but we will see his video presentation by Dr. Pagap Chatterjee. He is online, sorry, he is online, so we will see him online, and his topic is e-books for all. Thank you.